Joining me live now is Charlotte Hespe, Chair of the New South Wales Royal College of General Practitioners. Thanks very much for your time. I'm sure you've spoken to a lot of people reluctant to get the vaccine and perhaps gained a bit of an insight into their mindset. Let's go through the two ads. First of all, one of the dramatic one, a woman, an actor, we should stress, having difficulty breathing, and obviously the portrayal meant to be someone at the end stages of COVID. What did you make of that? What's your breakdown on how effective that might be?
Well, I'm not a media expert, just me looking at it. It's obviously playing on the emotional response that we have. For those of us as old as me, they might remember the HIV ads, which did a similar type of appeal back in the 1990s. So, and that's obviously what I would expect that the media is trying to do, is to try and actually bring home the emotional response to say, this is what could happen. We don't want this to happen to you, so please go out and get vaccinated. So, well, the proof will be in the pudding, won't it, to see how it works and whether it is sort of appropriately targeted as well.
The other ad, we see a lot of people smiling and they've got the small bandage over their arm, of course, where the jab's been. Just from personal experience, and I get my vaccinations, I must stress that. I've had flu this year. I'm keen to get COVID as well. Does this remind people that you're actually getting a jab? I don't like injections. I'm a wuss, I'm happy to say that. But is there a problem with this sort of everyone reminding, you're going to get a needle in your arm? Is it better to focus on something else, or am I taking my personal angle on this a bit too far?
Yeah, look, I mean, again, I can only look at it as an individual. I'm not an expert in how the media campaign advertising works. So again, it'll be interesting as to how it plays out. It's not exactly the level of campaign, the sort of thing I was expecting. But look, we've been really asking for a concerted campaign to come out from the federal government. So as a GP, I'm really happy that finally there is an ad campaign that's been launched. So let's see if it is effective or not. I'll leave it at that one.
Yeah, no, fair enough. Let me ask you this then. In your dealing with patients, if we talk about the broad category of vaccine hesitant, that might be anything from someone that doesn't like getting needles or doesn't like vaccinations to just being a little bit wary of a relatively new vaccine, what do you think that the best thing to tap into? What's the sort of concern that you think can be addressed through advertising that some of your patients are talking about?
Well, I think that certainly the emotional side of it is actually where most people can get it. When we're all afraid of the unknown, I think it is good to be able to go, well, why am I going to go into an area that is making me worried and is concerning me and I'm just not sure about? Well, if you actually go, I'm doing it because I really don't want my family to get sick, I don't want to get sick, and those around me I need to protect. To me, that's the engagement that I've certainly found from my patients is, why me? Well, me because these are your risks, me because these are your family who's at risk, etc. And up until now, and certainly this is my patient population, there has been very little sense of there's a personal risk because we did too good a job of keeping us safe, I suppose. And now, looking at the escalating numbers, that is just not the case anymore. And so there is that opportunity, I suppose, to play on what does it mean to me and why should I go and get vaccinated?
So in terms of that personal risk, because people look at the stats of dying are still relatively low, is something like showing long COVID in younger people and the possibility of that something people might see as could happen to them, something more realistic than dying? Is that something that might be tapped into later on in the campaign?
Yeah, and I agree with you entirely because I have heard very little spoken about for long COVID. It's very much more around the acute illness and the acute risks of dying, whereas what I'm seeing and reading about what really worries me is the long COVID, which is, been quoted about being 1 in 5 people who get the infection, and particularly those who don't necessarily have it very badly, are still at risk of getting long COVID, and it's got substantial implications in terms of general unwellness and, the sort of the effects on people's quality of life and health overall.
The AstraZeneca advice, of course, recently from Atagi. This current outbreak has seen quite a few younger people in hospital and even, I think, someone in their teens on a ventilator in the end. Is this the sort of thing Atagi needs to reassess pretty quickly around that sort of, risk matrix on the other side of the ledger, what COVID can do?
Yeah, look, I mean, I think from my perspective, the Atagi guidelines are very clear. What they're saying is that for the AstraZeneca, you can have a vaccine anytime from 4 weeks through to 12 weeks, with 12 being the optimum. The 4 to 12 is where you actually have to decide what your particular risk might be and why you want to have the second vaccination. So that's where they have provided less advice for us in the current situation. What they've said is in Australia, prior to the current Delta, that 12 weeks was absolutely what they would recommend. In New South Wales, we've seen Dr. Kerry Chand, as CHO, Chief Health Officer for New South Wales Health, advising that their recommendation is currently that people do think about having number 2 from 6 weeks onwards due to the current increased risk of being infected. And more to the point, the infectivity of the Delta strain. And what we're seeing is a number 1 vaccine, and this is really important for people to know, a number 1 vaccine protects you from from being terribly sick and having to go into hospital. And certainly it looks like it protects you from dying as well. So you really want that. So go out and get number 1. But it doesn't do such a good job on stopping you actually getting infected and or transmitting. Number 2 significantly ups the ante on your protection against getting into hospital, but also decreases your risk of infecting others.